Your skin is trying to tell you something. The back of your neck, your armpits, the skin around your waistline. These aren't random areas. They're some of the first places on the body to show visible signs of a problem affecting hundreds of millions of Americans, most of whom have no idea it's happening to them. And the reason it goes unnoticed for so long is that, in the early stages, it doesn't announce itself dramatically. It whispers. It shows up in things you can see, but never think to connect. By the time most people get a diagnosis, insulin resistance has often already been developing silently for years. One of the first signs tends to appear in an area most people would never connect to insulin resistance: the neck. Some people start noticing patches of skin that are darker than normal, brownish, sometimes with a slightly velvety texture. And the strangest part is that it doesn't look like dirt, a tan line, or something that improves with skincare or exfoliation. Most of the time, the problem isn't in the skin itself, it's happening underneath it. The name for this is acanthosis nigricans, and it's one of the most well-documented visible signs of elevated insulin in the body. When insulin levels are chronically high, insulin begins binding to receptors it was never meant for, including receptors that regulate skin cell growth. In certain areas of the body, this triggers an abnormal proliferation of skin cells. They multiply faster than they should. They accumulate. The result is a thickening and darkening of the skin, especially in areas where it naturally folds or creases. The back of the neck is one of the most common locations. And unlike a tan, this type of discoloration doesn't fade over time or lighten without sun exposure. It tends to deepen as insulin resistance progresses and improves when the underlying condition is treated. This isn't cosmetic, it's metabolic. And if you've been writing it off as something else, it's worth taking a second look. This next sign is something most people chalk up to aging or genetics. But there's a more specific explanation, and it changes what these growths actually mean. The name for them is skin tags, those small, soft, flesh-colored growths that hang from a thin stalk. They're extremely common, generally harmless, and most dermatologists will tell you there's nothing to worry about. That's partially true. One or two isolated skin tags are rarely significant, but multiple skin tags, especially when they cluster around the neck, armpits, or groin, tell a different story. The connection to insulin resistance follows the same mechanism as the skin darkening. Elevated insulin stimulates skin cell proliferation and the growth of fibroblasts, the cells responsible for producing connective tissue. Skin tags are essentially small excesses of that tissue. Studies have found that people with multiple skin tags are significantly more likely to have elevated insulin levels and impaired glucose metabolism than those without them. The more skin tags, and the more concentrated they are in certain areas, the stronger the association. One skin tag is one thing. A cluster of them, especially appearing in your 30s or 40s, alongside other signs on this list, is a pattern worth paying attention to. This is where insulin resistance stops being something you notice in the mirror and starts being something you feel in your body. The face may not change much, but the waistline expands, the belly grows, and it tends to feel firm and deep, not the soft, subcutaneous kind. Visceral fat is also metabolically active in a way that makes things worse. It releases inflammatory signals and fatty acids that further impair insulin sensitivity, creating a vicious cycle where more visceral fat leads to more insulin resistance, which leads to more visceral fat. A waist circumference above 35 inches for women and 40 inches for men is one of the clinical markers used to identify metabolic risk. But more telling than any single number is the pattern: fat accumulating specifically and disproportionately around the midsection, especially when combined with the other signs on this list. This next one is the sign that confuses people the most, because it seems completely unrelated to everything else on the list. Adult acne is usually seen as a skin problem, a hygiene problem, a hormonal issue for teenagers. For adults dealing with it, it can feel like something they just never grew out of. But there's a specific type of adult acne, persistent, inflammatory, concentrated along the jawline and lower face, that isn't caused by skincare habits or random hormonal fluctuation. It's driven by chronically elevated insulin. The mechanism has two parts. First, insulin directly stimulates the skin's sebaceous glands to produce more oil. More oil means more clogged pores. More clogged pores mean more acne, especially the deep inflammatory kind that doesn't respond well to topical treatments because the cause is internal. Second, elevated insulin increases androgen production, hormones that further amplify oil production and skin cell turnover. This is why insulin-driven acne tends to concentrate along the jaw and lower cheeks, the same areas most associated with androgen sensitivity. If you've been treating breakouts for years with products, diets, and routines that deliver partial results at best, and if anything else on this list resonates with you, it's worth considering that the root cause may not be what you're putting on your skin. Method 1. Take a short walk after meals. This is the intervention that surprises people the most because it sounds too simple to make a difference, but the physiology behind it is among the most well-established in metabolic research. Every time you eat, especially a meal containing carbohydrates, your blood glucose rises. The pancreas responds by releasing insulin to help cells absorb that glucose. In someone with insulin resistance, this process is sluggish. Glucose stays elevated longer. A 10 to 15-minute walk right after eating dramatically changes that equation. When your muscles are active, they can absorb glucose from the bloodstream directly, without needing insulin as the key. This is called non-insulin-mediated glucose uptake, and it's one of the most powerful tools you have for reducing post-meal glucose spikes. Studies consistently show that a short walk after meals, even just 10 minutes, reduces post-meal glucose significantly more than a longer walk taken at a different time of day. It's not about burning calories. It's about using your muscles as a glucose drain at exactly the moment blood sugar is peaking. After lunch, after dinner, 10 minutes, no equipment, the simplest metabolic intervention available, and one of the most effective. Method 2. Eat protein and fiber before your carbs. This one changes everything without changing what you eat, just the order in which you eat it. Research from Cornell University and several other institutions has shown that the sequence of macronutrients in a meal has a measurable effect on post-meal glucose and insulin levels, even when total calories and meal composition remain identical. Here's what happens when you eat carbs first. Glucose hits the bloodstream fast. Insulin spikes to catch it. If you already have insulin resistance, that spike is bigger and lasts longer. Now eat the same meal, but start with protein and fiber first. Protein triggers satiety hormones and slows gastric emptying. Fiber creates a physical barrier in the gut that slows glucose absorption. By the time the carbs arrive, the digestive environment is completely different. Glucose enters the bloodstream more gradually. The insulin response is smaller. The system isn't as overwhelmed. In practice, this means eating your salad before the rice, the chicken before the pasta, the vegetables before the bread. You don't need to eliminate anything. Just change the sequence and give your pancreas a chance to respond at a pace it can actually handle. Method 3. Improve sleep consistency and go to bed earlier. Of all the lifestyle factors that influence insulin sensitivity, sleep is the one most people overlook because it doesn't feel like a metabolic intervention. It just feels like sleep. But the data is unambiguous. A single night of poor sleep is enough to measurably reduce insulin sensitivity the next day. Not after weeks of bad sleep, after one night. Studies have shown that sleep deprivation produces a level of insulin resistance comparable to what's seen in people who followed a high-fat diet for months. The mechanism is multi-layered. Poor sleep raises cortisol, which directly opposes insulin, and raises blood glucose. It disrupts growth hormone secretion, which normally helps regulate fat metabolism overnight. It increases appetite-stimulating hormones the next day, leading to greater caloric intake and more glucose load on an already compromised system. But beyond sleep hours, there's another variable that rarely gets discussed: timing. People who sleep on consistent schedules, same bedtime, same wake time, including weekends, show measurably better insulin sensitivity than those who sleep the same number of hours but at irregular times. And people who shift their sleep earlier, even by just 30 to 60 minutes, show improvements in metabolic markers, independent of sleep duration. The goal isn't just to sleep more, it's to sleep at the right time, consistently, anchoring your body's internal clock so that the hormonal rhythms that regulate glucose and insulin can do their job without interference. Earlier, more consistent, every night. That combination, over weeks and months, creates a measurable, lasting shift in how your body handles insulin.